Hi, my name is Becky Sanders, and I'm the Program Director for the Upper Midwest Telehealth Resource Center. Thank you for joining us today. I'm going to toss things over to Luke Worley. He is one of our program coordinators for the Upper Midwest Telehealth Resource Center, and he's going to talk to us today about informed consent and documentation requirements for telehealth. Before I send it or pass things over to him, I do want to remind you that we are recording today's session. It will be posted on the UMTRC archived webinars page along with the slides. Everyone will be emailed that information once it gets posted in a couple of days. And please use the Q&A button at the bottom of your screen to ask questions, just in case we don't get to them all today. So we've got a record of those. And please only use the chat function if you have a technical question. And Autumn Daniels is assisting us today with the recording, and we'll be able to answer those for you. All right, Luke, take it away.
Thanks, Becky. Without further ado, I'm just going to jump right in. The way that this presentation is going to work is I'm going to cover what constitutes informed consent, and then what constitutes the documentation standards for each of the 4 states in turn, beginning with Indiana. And then for reference, once we do post the slide deck of this, I have hyperlinked the citation in the administrative code for all 4 states about what actually constitutes informed consent. It's interesting in a somewhat morbid way, I suppose, that we're talking about informed consent, because most of the overhaul of informed consent laws actually began in the late 1980s and early 1990s as a response to mandatory testing for HIV/AIDS. So another viral outbreak actually, spawned the latest standards in terms of informed consent. And according to Indiana's law, basically informed consent must be a fair explanation of the examination or consultation, including the purpose, potential uses, limitations, and the meaning of the exam results. And that can be found to be pursuant of Section 2, Title 16 of the Administrative Code. And Indiana's probably the most concise of the 4 states in terms of its definition of documentation standards, and that can be found through the State Department of Medicaid. Basically, for telehealth, documentation would be maintained as you would any other in-person visit, and you can read the rest of this particular paragraph here on your own time. The one thing that I will note is this sentence right here: provider should always give the member the choice between a traditional clinical encounter versus a telemedicine visit. So obviously right now, that's kind of a gray zone, but in sort of pre-COVID-19 and hopefully post-public health emergency times, just keep that in mind. I thought I saw a notification pop up. Becky, did you take care of that? Yeah, there's 2 in chat, I suppose. Oh, sorry about that. I thought that was a question for me. All right, we'll keep going. So like I said, Indiana is pretty concise on what they have to offer here. The other thing that I want to draw your attention to is this final sentence, that providers must have written protocols for circumstances when the member requires a hands-on visit with the provider. So you have to have some kind of workflow mapped out and have it documented that you've followed that protocol. So now we'll move on to Illinois. Per the Illinois Department of Health and Family Services, pursuant to the executive order issued by the governor's office in mid-March, the patient must verbally consent to receive virtual check-in services or telehealth services. And at the point of admission for services, any licensed organization must obtain written informed consent. Obviously, that distinction has been lifted by this executive order during this public health emergency. And I will go over at the very end of this presentation a sort of sample workflow on how you might obtain that verbal consent if written consent is not an option when you're only seeing them via synchronous two-way audio or audio-visual communication as opposed to in person. So Illinois goes a little bit further in defining informed consent as permission for a procedure freely granted by a person or persons authorized by law to give consent to services and treatment plans. And that is pursuant to section 112.3, Title 59 of the Administrative Code. If you want to read the rest of that entry, I also have that hyperlinked. Contrary to Indiana's sort of one paragraph documentation standard, Illinois goes into a little bit more depth, talking about medical records have to be maintained at the originating and distant sites. This is pretty standard language for all 4 states, but they actually outline the exact requirements here. So we'll move on to Michigan. Their definition of informed consent sort of falls in line with the other states in that it has to be, you know, given freely with full knowledge and explanation. And then finally here, it actually designates a health professional shall not provide a telehealth service without directly or indirectly obtaining consent for treatment. So that directly or indirectly phrase can be interpreted, I think, to say that verbal consent is sufficient. And obviously during this public health emergency, that is more than sufficient. Michigan's documentation standards are the exact same as they would be for any other in-person visit in terms of the retention of records. And you can find that in Chapter 333, which is an updated version of an old act in a different section of the administrative code. But basically, Michigan also requires that the records be provided upon request within a particular time period. So that's the one little wrinkle in the Michigan documentation standard that deviates from some of the other ones. Additionally, I think that this is an incredibly useful tool here. The Michigan Medicaid Provider Manual on pages 51 to 56 outlines pretty explicitly what needs to be kept in the medical record in order to be in compliance. So we'll move on to Ohio. And again, it uses a lot of the same language, the nature and purpose of the procedure, the reasonably known risks, you know, person making consent acknowledges that disclosure of information has been made, and that all questions asked about the procedures have been answered. Very standard language here. Basically, you know, you have to have a patient who is able to give consent, and that the physician has provided all necessary information about this particular encounter. Interestingly enough, as part of Ohio's mid-March executive order, one of the sentences that came out of it was providers must document their telemedicine and meet minimum standards of care. And it took me a little while to actually go find what that definition is in terms of Ohio's administrative code. And I found actually that the best description of the minimum standard of care actually falls under the prescription of medical marijuana. And I think that even though it is listed under that particular part of the administrative code, it outlines a very succinct method for meeting minimum standard of care for pretty much any clinical encounter, in my opinion. So you can find that per chat. Actually, I don't have that linked. I will have to modify that before we post it and get that linked. For further documentation standards, I have that particular part of the code linked. The practitioner site has to have access to medical records of the patient at the time of service, and maintaining documentation in accordance with paragraph C1, which states that all services provided via telehealth shall be in accordance with state and federal laws, including HIPAA. And of course, that is the exact same documentation standards as you would for any in-person visit as well. So again, here's another link that further builds on that language from the previous slide. So I'm going to pause there for just a moment before we get into any of the actual like samples or workflow, sample of workflow, or a sample telemedicine consultation consent form, that kind of thing, just to see if there are any questions in the Q&A that we haven't answered. Becky, have you seen any?
No, I am not seeing any questions in the Q&A.
Okay. So we'll get back to this. So, so functionally, what does all this mean and what does it actually look like? CMS, you should know, if you haven't, if you didn't already, that they're not going to enforce HIPAA sanctions for using non-encrypted software. So if you're going to engage in a telemedicine, clinical encounter, you can use non-encrypted software, but we at the UMTRC are absolutely still encouraging you to use encrypted software that is HIPAA compliant if you have access to it. So just so you know, that's our official position, but if you are in a bind, you can in fact use other platforms. And then I have a link here to the actual order that says that verbal consent is sufficient during the state of emergency, because obviously the number of patients that you can see in your office has been cut down substantially. And I've already given you the citations for the codes in your state, but when you actually are on the line here, like we would be on a Zoom call with a patient, what does getting consent look like? So we have linked here an informed consent for telehealth consultation form, and it's one page, so it's easily shared on the screen. Since a lot of telehealth codes require the use of two-way audio-visual communication, it actually is super easy for you to take this one-page telehealth consultation form, modify it for your particular practice, and then as soon as the patient initiates the contact with you, you show your screen like I'm doing right now for this slide deck, kind of walk through each of these bullet points, and then document the fact that you have presented all of that and that the patient has given their informed consent. And then you can stop sharing your screen and proceed with the telemedicine encounter, just as it were a face-to-face encounter or in-person encounter. Face-to-face is a little bit outdated considering the video component actually can be interpreted as face-to-face. So I think that's probably the best way to do it. And then it's important to note too that you don't have to do this every single time you initiate a telehealth visit or a telemedicine encounter with a patient. Their verbal consent for telehealth consultation or telemedicine encounters works the exact same way as signing a consent form would work in the office. So I'm going to go ahead and pause there before we get into some other general advice and resources that we have listed on our website. I see some Q&A popping up.
Do you want me to read them to you, or?
I just stopped sharing my screen and opened it up. Okay, how should the consent be obtained for pediatric patients when the parent is not present? For example, a patient who is inpatient, but parent is quarantined or restricted from visiting. That is an interesting scenario. I was actually just asking Becky the other day if we had any guidance on people being in the room. We hadn't really talked about people potentially not being present.
Yeah, I think that the age with electronic health records is 14, and once the kid turns 15, they don't have to have parent consent.
I know that that's right for seeking any kind of behavioral health. I'm not exactly sure what that would look like if there
Yeah,
are
Kathy, you
a.
may want to email us that question and we can dig into that a little bit. Um, I would assume that a verbal conversation with the parent would probably be sufficient in today's public health emergency.
Why deal with telehealth separately than a general consent to treat with a brief telehealth language included? Many sites are just incorporating into general annual consent to treat. Is that not okay? No, I think that that's fine. I think that you have to be very explicit in your documentation that you are using the telehealth option. As you saw, at least 2 of our 4 states require the distinction between seeing that you have to give them the option between an in-office visit and a telemedicine visit. So I think that that's okay if you add that language to your general consent form. But when you're talking to the patient live, I think you have to make sure that that is highlighted. Would remote patient monitoring consent forms be the same? Can you use one form for RPM, CCM, and telemedicine?
I've never looked into that, but I'm assuming the answer would be yes. I don't see why not.
Yeah, I would think so too. I think, you know, similar to what the last question was asking is, you know, can you just make an addendum, you know, to your, if you have a general telemedicine consent form, you could just make an addendum that these are the specific services that we're providing on this particular, in this particular encounter. I would just, you know, in order to make sure that everybody's in compliance, just make sure that you're being as specific as humanly possible when you're trying to obtain that consent verbally. You know, that just needs to, for documentation purposes, you need to be able to demonstrate, yes, yeah, I informed the patient that this was the service that we were providing for this particular encounter. At least that would be my preference if I were documenting. Okay. So we'll go back to my screen. Again, once this gets posted, you'll be able to click this link and it'll take you to our website for a sample 1-page document if you don't have one already created. All right, so the other thing that I would like you to get out of this particular slide is that I've went ahead and collated all the links to some of our recent resources that we've updated specific to COVID-19, as well as general FAQs, technology toolkits, the Center for Connected Health Policy, which is housed at one of our national telehealth resource centers, has a great policy tracker and a searchable database of legislation. And CMS on April 30th updated their list of telehealth codes, some of which can actually be billed now for audio only, and they're waiving the video requirement for some of those codes. That link can be found right here. There's a downloadable zip file with an Excel spreadsheet that actually has a column dedicated to that. HIPAA's been very good about updating their guidance when it comes to the public health emergency. And then finally, if you want to receive more consistent updates and communications from us, you can click on this link as well. I saw another Q&A, let me see. 14 years old for consent. Which state? Illinois is 12 and under for mental behavioral health substance use treatment, and 18 and over for most medical. I know that in Indiana, it's the age of consent is 15 when it comes to that kind of medical service. Might not be the same for every state. So
yeah, we've got a comment. Michigan is 14.
yeah,
so I didn't realize that was different by state. I thought it was federal.
Yeah, it might be that we need to add that particular component to this. I might just create another slide to make sure that's addressed. Regarding the HIPAA restrictions that were lifted during the state of emergency, does this all change as soon as that is expired? We are still under a modified schedule and definitely will be using telehealth for some patients for quite a while. We're in Michigan. I fully expect, and this is just my speculation, this isn't any inside baseball or anything, but I fully expect HIPAA sanctions to be reinstated immediately once the public health emergency designation has been lifted. So I would say that if you're planning on adopting telehealth for long-term use, that you do a little bit more research into making sure that every platform or solution that you choose to employ is HIPAA compliant.
Yeah, I would agree. The state of Michigan was interesting when they did their emergency, what's the word they used? Expansion of Medicare for telehealth during the public health emergency. Is they said that, you know, certain non-HIPAA compliant platforms were okay, and some of the other waivers, I can't remember if it was specifically tied to HIPAA or not, but they had language in there that said based on, or this language is in effect until 30 days after the end of the public health emergency declared in the state of Michigan, or the first of the following month, whichever happens first.
Yeah, we've been getting a lot of questions about, you know, what parts of the waiver are going to stick around. There's not really any hard concrete information to go on that front, but I can almost guarantee you that the one thing we can predict is that HIPAA sanctions will go back into effect immediately. I mean, I'm sure that they'll make it retroactive to a certain date, so where like so if you had a telemedicine encounter on a non-HIPAA compliant or non-encrypted platform before a certain date, you'll be fine. But after a certain date, I think that those sanctions for billing those encounters will go back into place. Any other questions? Yeah.
If there's not any other questions, we'll hang out here for a couple of minutes. Autumn did put in the chat, we have our survey. Please fill out this couple of questions Survey Monkey survey, and we appreciate your feedback as we have to track all of the technical assistance that we do and all of the outreach that we do via these virtual office hours and webinars. And if that's all, I guess we'll remind you guys again, we did record today's event. It will be posted on our UMTRC archive webinars page, the slides as well as the recording.
What if we haven't gotten, I'm sorry, what is the, up to the, I think I was supposed to say up to this point. So I guess, are they, my follow-up question would be, are they a returning patient or a new patient? As in both, or they're a returning patient? I don't know, Becky, returning patient. So they are an established patient. I would still, just for documentation purposes, go ahead and the next time you see them, mention that, you know, we just to dot all of our T's and cross all of our, or dot all of our T's, dot all of our I's and cross our T's. We need to make sure that that you give your consent to be seen via telehealth options.
Yeah. Well, I was gonna say, if you have a patient portal with that patient, you could send them information via email and have them complete something in the patient portal. You could use snail mail and send something out to those patients and ask them to complete and send the form back to the office. Lots of different options there.
I recently heard on a CMS webinar that an annual consent is also needed for each patient. Are you aware of this stipulation? Yeah, and I think that that's why we're doing this particular presentation now, is that that informed consent component it functions the same way as getting that annual consent in the office. It's just that if you're going to be doing a telemedicine clinical encounter, virtually, that the patient just needs to consent to that option as well. And it functions the exact same way.
All right, last chance for questions. All right, Luke, thank you very much for doing this for us today. I really appreciate it. And everyone else, have a great rest of your day and a safe and happy Memorial Day weekend.